This is the Cancer Interviews podcast, and I'm your host, Bruce Morton. Our guest on this episode not only survived bowel cancer, but she has come up with a creative way to help women diagnosed with below-the-belt cancers. She is Helinka Carr of Leeds, United Kingdom, and let's hear her story. Helinka, welcome to Cancer Interviews.
Thank you so much for having me. Really appreciate it.
Helinka, we want to start off the way we always do, and that's to learn a little bit more about you, your life exclusive of cancer. So if you would, tell us a bit about where you're from, what you've done for work, and what you like to do for fun.
Right, well, obviously I'm from Leeds, West Yorkshire, best county to live in UK. I used to manage a hostel for single homeless men, and that was my passion, was to work with people that were the underdogs, whether it was fleeing domestic abuse, mental health, addictions, and all the other topics that people don't like to talk about. So I'd done that for many, many years and gained oodles and oodles of skills and ways to talk to people and the way to understand people. And I used to get some really good results, which was important. What do I like to do for fun? Outside. I know it's really cliche, but I do like to be outside, listening to nature, going for a walk, pottering in the garden. I love to learn, I love to read, and just family time.
Now let's talk about your cancer journey. For all of us, our cancer journeys did not just materialize from thin air. There were symptoms, and then they eventually led to a diagnosis. For you, when did you initially notice that something wasn't quite right?
To be honest, in the UK at the time, it was the notifications and the adverts were if you have bleeding for 3 weeks from your back passage, if you have loose stools for 3 weeks from your back passage, and if you have pain or discomfort for 3 weeks. And that was the benchmark for bowel cancer over here. Well, I never did. I had the occasional bleed, which would maybe be half a day, maybe a day. I used to eat a lot of fruit and vegetables, so obviously that's your output's going to be a bit loose. And occasionally I'd have a bit of a discomfort or pain on the left-hand side of my body. But other than that, I didn't. I really didn't.
So that eventually, however, led to a diagnosis. What was the chain of events from that point forward that led to your diagnosis?
Well, my daughter noticed that I was touching my side of my body, and she just kept saying, can you just go get it checked out? Can you just go get it checked out? So I relented and then phoned my GP, explained that I have the occasional bleeding from the bum and I have a bit of a pain on the side. And she just said, right, fine, round of blood tests. And then the GP saw me the following day and then just did a internal examination of the bowel, of the rectum, and she didn't say anything then. And then once we sat down, she just says, do you think this might be cancer? And I went, but why would it be? You know what I mean? It's over here, it was 65 and above that got bowel cancer, not 46. So then she sent me for a colonoscopy, and then that's when it all changed. I had a great experience in the colonoscopy though. I had a lovely nurse, and he was saying to me, oh, you're a couple of years older than me, they'll shove any probe in any orifice you've got. And I went, oh, thanks a bloody bunch. So we'd having a good laugh and a joke and whatever. And then once I started doing the procedure, then the atmosphere just changed. And then it was like he'd realised that there was something really untoward within the bowel and such. And afterwards, he just kept saying to me, but you're only 2 years older than me. You're only 2 years older than me. This shouldn't be happening. This shouldn't be happening. And I'm thinking, well, it is as it is, isn't it? Can't change it.
Helinka, if you, knowing what you now know, if you were hit with these same symptoms a second time, would you have reacted a little more quickly?
No, I wouldn't, because my family have diverticulitis in there, and it presents the same. So why would I even give it a consideration that it's going to be bowel cancer when like you say, you looked at the publicity, it was you had to have the symptoms for 3 weeks, you had to be 60 to 65. I was 46. It only happened occasionally. I would never would have thought it. Not at all.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share this with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we post an interview. And we want to remind you that on Cancer Interviews, we are not distributors of medical advice. If you seek medical advice, please consult a licensed healthcare professional. Now, Helinka, in our interviews, we have heard from many guests about the importance of self-advocacy, that you are your best advocate. After your diagnosis, if you would tell us, how did you advocate for yourself?
Well, I refused chemotherapy. That was it. Wasn't having that. Told my family right from the onset that wasn't going to happen. I said I'd go through radiotherapy for them, but I wasn't going to go through chemotherapy. I'm a complementary healer as well, so I was using all of those tools as well to support me to reduce the tumour that I had. But I had one funny story. My husband, I'd gridded the bed thinking, well, I spend a lot of time in bed because you spend about 8 hours, don't you? So I grid the bed with the crystals, but I did the whole bed. And after a couple of nights, my husband said to me, I'm not sleeping properly. It feels like I'm on a boat. It's always moving and it's always vibrating. So I thought, oh, I better just put him on my half of the bed then. And he slept perfectly fine after that. So, yeah, that was quite funny because there's people saying, how can crystals and your thought process work? But it does. I still use the conventional process, but I also used the complementary as well. I don't know, do you remember the Space Invader games? You know, the really old one in the 70s? Yeah, well, there was an article on that a long time back, and they were saying that the people that were told that the aliens that were coming down was the cancer cells, and then the spaceships at the bottom was your immune system kicking in. So I visualised that regularly as well, that we was winning with the immune system, because once you wake the immune system up, it has such a powerful effect on your well-being and also helping you to reduce the symptoms. And for me, I reduced it down by 45% before surgery.
So you eschewed chemotherapy, but you did undergo a radiation regimen. Helinka, what was the toughest part of the radiation treatment?
Going in and having it. I went for my first appointment. They said they had this, no disrespect to this young lass, but it was a young lass that was talking to me, and she's saying, who you having the treatment for? And I went, well, my family. And she went, well, you can't have it. I can't let you have it. And I went, sorry. Oh, you mean, who the hell are you? I said, are you a mum? No. Are you a wife? No. I said, don't bloody well tell me I can't have this treatment because that's who I'm having it for their peace of mind. I said, so no, don't tell me I can't do it. So yeah, I was stunned.
Now, the eschewing of the chemotherapy and the complementary regimen that you referenced just now, I think I know the answer to this yes/no question, but I'll ask anyway. Are you glad you went this route?
I would rather have not done the radiotherapy because that's left me with pelvic radiation disease, which now means I cannot feel my bowel, I can't feel my bladder, and it's just, even when I touch it, I can't actually feel it. It feels different. So when I need to go for a wee or anything, I'm relying on my head saying, you need to go for a wee because I can't feel my bladder anymore. So pelvic radiation disease, yeah. The gift that keeps on giving.
But what do you think would have happened in terms of your addressing your bowel cancer if you hadn't had the radiation?
I would have still shrunk it down to 45%, and it still would have been removed absolutely brilliantly because I'm an amazing surgeon. But I wouldn't have the aftermath. And like you said, one of the consultants said, radiotherapy is a gift that keeps on giving. It changes from week to week, month to month, how it's going to affect you, how it affects your body and how it affects you inside and such. So, yeah, I wouldn't have the radiotherapy again, never.
Now, you mentioned some of the some of the areas in which you are adversely affected by your procedure. Any other areas that leave you shy of 100%? If we could call your health pre-diagnosis, if we could call that 100%, are there any other ways in which you are shy of 100%?
Stamina. The fatigue can sort of overwhelm you at times. I don't think it's embarrassment of what you've gone through. It's just, it's not a sexy cancer. Like say, if it's breast cancer, it's sort of, it's more openly discussed and talked about. But no, I think it's the fatigue more than anything else, and just lack of energy sometimes. And obviously, because I have an ileostomy, which is where it comes from, the small bowel, not the large bowel, you can tendency to have diarrhea quite a bit. And as you know yourself, if you just have normal diarrhea, how tired that leaves you. But if you've had it where you've got 2 or 3 days of really runny output because you've got an ileostomy and not a colostomy, then that tires you out as well. And it's your vitamins and minerals you've got to be mindful of, that you actually are getting them absorbed within your body.
Now, we've heard from guests who have had the colostomy bag, and they have different experiences in terms of being introduced to it, the level of care they got from their nurse as they were learning how to manage the bag. What was your experience like when you first learned about the ileostomy and that this was now going to be part of your life?
Well, to be fair and honest, my consultant had pulled me in for an impromptu meeting, and he's saying, right, I need to explain to you again what procedures we're going to go through, and at the end of the day you're going to end up with an ileostomy. And I went, no, I'm not having an ileostomy, there's no need. And then he sort of said, yeah, but you need to, so that your bowel can heal properly from the surgery, and then I'll remove it. He did tell me a big fib. He said he'd remove it in 6 weeks. It was 12 weeks. Compared to some people, that's a short time. But then what he did do, he said, I need you to talk to the professionals. So he took me down to the Ostomy nurse team, and they sat down with me and said, look, we will totally and absolutely support you through this. We'll be there when you wake up from your surgery. We'll make sure that you're comfortable and happy. And to be honest, I had an amazing community Ostomy nurse as well. She was just brilliant. She was there all the way through for me.
So I just want to be clear, the ileostomy is no longer part of your life. It was just something that you had to deal with for 12 weeks?
It was for 12 weeks, and then I had from December 13th to December 16th, I was incontinent. As you can imagine, that went down a storm. Couldn't leave the house. I was on the toilet. Like I say, just literally after about 2 p.m, I just sat in the bathroom, and that was it, because my bowel was just absolutely jigged. So December 2016, they then said, we'll put you back another ileostomy, because I had no quality of life. I couldn't, as you know, if you're walking, that gets your bowel to move more and such. I couldn't even go out. I couldn't even leave the house with, go do boring things like food shopping. Well, glad I didn't have to do that, mind. But it was a case of, for my quality of life, I have to have the bag back. So I made that choice and said no. And that was me, because the consultant was saying, but there's other things we can do for you. I said, yes, but is it going to stop me being incontinent? And he went, I can't guarantee it. I said, well, then give me the bag back. Give me the ileostomy.
And do you have any difficulty managing it, maintaining it?
No, because I found the system that works for me. I wear a 2-piece, which is absolutely brilliant, because then on the night, during the day I'll wear a smaller bag, because obviously you go into the bathroom for the wheeze and whatever anyway, so it's easy. But on an evening I can then put a bigger bag on, and then I can get 6 to 8 hours sleep, which who don't want that? So I've just found a system that really works for me. It's brilliant.
Would you say, Helinka, that your quality of life, well, certainly not what it was before your diagnosis, but would you say now that it is about as good as it can be?
I'm hoping I can get a little bit better, hopefully, get a little bit more stronger and being able to do more. But I'm not in a rotten place. I do go out. I mean, nothing keeps me in. Nothing prevents me other than when I'm absolutely exhausted. But I will keep doing and going and moving forward.
Now, we want to talk about something that we alluded to at the very top of the interview, and that is that you have come up with an interesting, creative way to help other women who have been diagnosed with below-the-belt cancers. If you would, tell us exactly what that is.
Well, I'm a lady who has matching lingerie, so the bras and the knickers always have to match. And when I came round from the second surgery, I thought, okay, then I'll be able to find, lingerie that will accommodate my stoma and Ileostomy. Well, no, did I chuffers? Didn't find anything that would what I would choose to wear. I appreciate and understand that having the medical model, the support belts and the really tight support that you can buy are needed. But I wasn't going to wear that every day. So I then went out and researched, found the best laces I could possibly find so that you can have a lovely lace band covering it up and it just looks so elegant and pretty. I found cotton jerseys that have got patterns on so that can cover your bag up. And it's just like, why shouldn't we feel pretty and elegant and beautiful? Why, I'm not bothered if people see my bag. It doesn't bother me. But I know there's a lot of people out there who really get quite anxious with it. But when you're wearing one of my bands or the lingerie, nobody can see it, so you can move around quite comfortably because it's there and it's pretty and it holds your bag in place, but it's not there as a support. It's there to just look blooming gorgeous.
Helinka, this question may have a little bit of ignorance attached to it because it's coming from a male about matters that are female. But if you would just elaborate a bit on behalf of those who have been diagnosed with below-the-belt cancers, how important is it for a woman in your position and a woman in a position of being diagnosed with a below-the-belt cancer, how important is it to have that feeling of feeling attractive, feeling sexy, if you will?
Well, to be fair and honest, I mean, it's for men as well. I do make the wraps for men as well, and they've often said being able to wear this and have intimate moments and not have to think about it, not have to worry about it, it's just there. They said it's so uplifting. I mean, I've had ladies of, I think she was about 77, and she said, please, can you rush one to me? I'm off on my first date because that I've not had in years, and I want to wear this so that I can have some fun. And I thought, credit to you, love. Credit to you. And that's what it's about. It's empowering people to be able to make choices on. I know there's another company and they do crotchless knickers, which I can't quite get my head around. But with my bands, you say you can have all the fun. You can just to look at yourself and just go, yeah, I'm looking all right today. I'm pretty. I'm happy.
Well, in our description and show notes below that accompany this interview, we're going to have information, Helinka, that people can access so they can learn more about your lingerie line. Now, we're going to conclude, and we're going to conclude the way we usually do, and that is that if you ran into somebody who had just been diagnosed with bowel cancer, that person may have a lot of questions for you, but and I suspect you would have a lot of answers. But if there's one point that you would want to drive home to this person who's just been diagnosed with bowel cancer, one thing you wanted to make sure they remembered, what would it be?
Like you say, advocate for yourself. If you're not sure about a treatment, ask questions. If you're not sure about the surgery, ask the questions. Speak up, shout out. And if you're not happy, then go find somebody else who can give you the answers. But don't go down the rabbit hole of the internet, because hellfire, you could be there on there for days and days and days and get so confused. So look at professional sites. That then will help you make that informed decision. But if you're not happy, not sure, speak up.
Excellent. Helinka Carr, Leeds, United Kingdom. Thank you very much for sharing your story with us. thank you for sharing the story of the lingerie line that you have come up with. I have no doubt that's going to be helpful for numerous women, and as I've learned from this interview, it can be helpful for numerous men too. So Helinka, thanks once again for being with us on Cancer Interviews.
Thank you so much for this opportunity. It's been brilliant.
And we want to remind you, when we conclude, as we always do, that if you are on a cancer journey, you or a loved one, you are not alone. There are people out there like Helinka Carr who have information and inspiration that can aid that cancer journey. So until next time, we'll see you on down the road.